If you have pain in this particular area that you got either from injury, long hours of sitting, or lifting weights, this is a video for you. In this video, we're going to see how to resolve the most common trigger of low back pain in this area. It's a solution based on simple biomechanics that I used for years to general population and athletes. So in the next 6 minutes, you're going to learn the 3-step process that took me years to figure out. This process includes 1. Understand what is the most probable cause of this issue, 2. The exercises that will relieve your symptoms, and 3. The program that will make sure that you'll never get this pain again. However, this process is a bit more structured than random lower back exercises that you'll find on the net, so I'll advise you to sit back and watch all the steps of this video carefully before you try this out. And before I dive into the video, just know that I'm on a quest to provide quality content on fitness related topics, so make sure to subscribe to this channel so you don't miss out. So let's start with step 1 and explain what is the most probable cause of this issue in less than 60 seconds. The cause of lower back pain in general can be extremely complicated and multidimensional. Surprisingly though, I found by experience that most of the people that come to me with lower back pain have the same common issue. And that is a muscle spasm, tightness or imbalance on the quadratus lumborum muscle, aka the QL muscle. The QL muscle is located exactly on this area and connects the lower part of the 12th rib with the iliac crest of the hips. It is, however, under the big and thick erector spinae muscles, and this makes it almost impossible to reach it with self-massage or manual therapy. Trouble in this muscle generates diffused pain in the lower part of your back that is either on the right or the left side. This condition can be created by long hours of sitting, wrong posture, weak posterior chain muscles, and more often lifting weights with imbalanced sides. To me, the QL muscle is the missing link on the strength of the posterior chain muscles, and it's something that I don't see anyone train consistently. But before we get to training, let's move to step 2, which is the exercises you need to do to relieve your pain. The only exercise you need is the seated QL stretch. This is also the only exercise that targets only the QL and no other muscles. Now please pay attention on how to do this because it's easy to get lost in the details. From seated position with wide stance on the feet, lean towards the opposite side of the painful side. If you have pain on the right side, lean to your left, and if you have pain on your left side, lean to your right. You should aim for the center of your chest to hit the center of your knee. This involves both a side bend and the rotation of the spine. Only rotating without going low enough or only lowering your body without rotating will not get the job done. Also, be sure to avoid the common mistake of losing the position of the opposite leg. The opposite leg should stay in place so that the same glute will stay in touch with the bench. If you lift the glute of the opposite side or cave in your opposite knee, you completely lose the exercise. Now from this point, assist with your arms to go into the deepest possible position and breathe. You should feel a stretch or pain on the area that troubles you. In addition, you can go even deeper with the help of a partner. The partner can stabilize your opposite leg and assist your bend and rotation with a slight push. Remember that you should both go down and rotate. Now to relieve your symptoms, you should do both passive and active work on the QL muscle. The passive involves static stretching on the end of this position for 30 to 60 seconds on each side for 3 to 4 sets. After that, you want to actively work with the same muscle. You can do that by moving in and out from the same spot. If you don't feel comfortable to lift your body weight, assist the movement with your arms so that the intensity of the exercise is significantly reduced. Over time, you want to progress to doing this without assistance. You can start with 3 sets of 6 repetitions on each side and gradually progress to more sets and reps. These 2 ways of applying the same exercise will dramatically improve your condition. I recommend doing them many times during the day at the acute phase of the pain, and as your symptoms go away, you can keep this routine once every day. After all, this is a great activation for lower back muscles, even for people that are not in pain. But you're probably wondering if these 2 exercises is all you need. Of course, there are a dozen more exercises for lower back pain in general, but this one focuses at the heart of the problem. Remember that you want one thing that works and not hundreds of things that kind of work. I've seen more improvement by just doing this one movement than all the other exercises combined, and this is why I honestly believe that you should keep this simple. Other things that are commonly used but won't make much of a difference here are self-massage and manual therapy. I personally love foam rolling, but it won't access the position of the QL muscle that is under larger muscle groups. This means that when you foam roll this area, you mainly massage the muscles that are over the QL muscle and the pressure cannot get that low. It might offer some minor relief, but it doesn't target the muscle properly. Same goes for manual therapy. So now let's move to step 3, which is how to make sure that you have an iron QL muscle that will never trouble you again. This involves a really small training program that focuses on the muscle's flexibility, balance strength between the two sides, and muscle endurance. You can start this as soon as most, but not necessarily all of the pain is gone. This program starts by working on flexibility with 2 sets of 30 to 60 second static stretching on each side of the QL stretch. If you can, do this with a partner as described in step 2. Then we have the strength program that involves 2 different movements of the spine. One side bend with the chest facing forward and one side bend with rotation and the chest turning downwards as we did earlier. This program should start with low repetitions around 6 to 8 and only with body weight. Over time, you can advance to more repetitions and sets and gradually progress to increasing intensity with weights or cables. Once you get stronger and you can move some weight with comfort, usually between 5 to 10 kilos, you should divide your training in strength and strength endurance. To do that, you will keep the weighted sets with relatively low repetitions and add some sets with lower or no weight with high repetitions. For example, 3 sets of 10 reps at 7 kilos and 3 sets of 20 reps with body weight. The first focuses on strength and the second on strength endurance. From here, you can advance according to your progress. And if this all seems confusing to you, I'll link in the description below a detailed program that incorporates all these recommendations. It's going to be completely free for the first 3 months following the publishing of this video, so you might want to share this with more people. And I also have an important note for those that train regularly. People that lift weights should be more consistent on training this muscle and developing its capacity symmetrically with the development of the rest of the posterior chain muscles. You see, the QL muscle is one of the main forces that balances your hips. By increasing the strength and size of the muscles that surround this area with squats and deadlifts, while neglecting the QL, you will inevitably create trouble in your lower back. I've seen lifters having troubles for years until they find out that the only thing missing from their training program was a stronger QL muscle. For this reason, I plan on doing a video specifically on how to train and progressively load this muscle, on what is the ratio of strength that you should achieve on this side bend compared to other movements like the deadlifts, and on what is the ideal way of incorporating these exercises to a standard strength program. I plan on doing this video in the near future, so make sure to hit the link on the screen so you don't lose it. I really hope this video helps you. 3 of the 6 members of my family, me, my brother and father, have been struggling for years with this pain, and it was a huge relief when I finally figured out this simple solution. After that, we have had no pain to this day. I really feel for the people that struggle with this issue, and I hope this video reaches as many of them as possible. So if you like the video, make sure to share it and help me provide more videos like this one by liking and subscribing. Thanks for watching, and I'll see you all next time.